Bula Vinaka. Welcome to Sova Ni Bula Quick Reference Guide website version for SOPD Nurse. In this video, we will look at the following features: pre-entry of lab results, checking in a patient, updating the queue, adding vital signs, and reserving the next appointment date. To begin with, we will look at the pre-entry feature. Nurses may enter the lab results up to a week before the patient's visit. For patients with upcoming appointments in the following week, copy the laboratory results from the PATIS Plus system using the pre-entry feature. To do this, click on the bell icon for reminder. This will bring you to the appointments page. The appointments are categorized into 4 different categories. These are today's appointments, appointments due in a week, appointments due in a month, and those who have defaulted their appointments. You will also be able to see the date of the appointment, name of the patient, manual folder number, contact information, order of the patient queue, and the status of each patient's queue from here. Search through for the patient you wish to do the pre-entry for and click on the person icon under the behavior column. Wait for a few seconds to be redirected to the patient's information page. From here, click on the Health Information tab. Then click on Pre-entry to activate all patient icons, which will then be displayed in green. Click on the Add Laboratory Result. Copy lab result values from the PATIS Plus system to Sova Ni Bula system. You may search up the patient on PATIS Plus and view their recent lab results. Next, copy those results directly to Sova Ni Bula. From the laboratory results window, choose the relevant test group items from the left-hand menu and key in the lab values. For the purpose of this demonstration, we will enter blood glucose results. Upon clicking on Submission Date, a calendar view will pop up. Select the date that the test results were submitted. Next, click on the Report Date and select the date that the test results were reported. Once all the details have been filled, click OK to save the record. Next, click on Pre-entry again to close the pre-entry. You may view the results entered from the Examination Record tab. You may filter the records according to the test type. Click on All to reveal the drop-down list. Over the course of the SOPD clinics for that patient, a trend line will form showing the trend of that particular test. Next, we will move on to the functions that will be used on the clinic day. Step 1. Log into the system and search for the scheduled patients. All patients scheduled for health center visit can be found under the Reminder section. Click on the bell icon to view all patient appointments. Here you can see the order of the queue and select patients for checkup accordingly. Under Today's section, click on the patient icon to be redirected to the patient profile as per the order of the queue. Step 2. Case Management. View the patient's profile and select Health Information tab to check in the patient. Click on Health Information tab. Next, click on Check-in to indicate that the patient checkup has begun. Upon clicking Check-in, the icon colors for various nodes will change from green to gray. Step 3. Patient Queue. Click on the SOPD Nurse title beside Case Management to update the queue. The color will change from red to orange. The color indicators for the queue are as follows. Red indicates that the patient has not yet been seen by that staff. Orange indicates that the patient is being consulted by that staff. Green indicates that the patient has already been consulted by that staff. Moving on to step 4, health information. Add triage data. Assess the patient and enter triage details using the vital sign features. This tab contains all medical recording features such as vital signs, laboratory result, surveys, eye care notes, foot assessment notes, dental notes, and nephropathy notes. Click on Add Vital Sign. All vital signs including BMI, blood pressure, blood sugar, waist-hip ratio, temperature, respiratory rate, SpO2, heart rate, and nurse's note are all included here. Enter the respective values, then click OK to save. After saving the note, all results will be displayed on the right-hand side. These notes can then be seen by the medical officer, dietitian, and physiotherapist. Once triage has been completed, ensure to write the triage details in the patient's wellness booklet. Next, we will move on to step 5, reserve function. Click on reserve to set the next appointment date. From the calendar, select the next date for patient visit and click OK. Note: the system calendar will automatically open up to the next appointment date based on pen color. Only the SOPD nurse and MO can revise the date using the reserve function. After selecting the date, click OK. Ensure to write the patient's appointment date in the patient's wellness booklet. Now that the triage has been completed and the appointment date has been set, we will move to step 6 to update the patient queue. Click on the SOPD nurse beside the case management to update the queue again. The color will change from orange to green, indicating that the nurse's consultation has been completed. If the patient is to see a foot care nurse on the same clinic day, the foot care nurse will directly log into the Sova Ni Bula system, view the patient from the appointment section, and then from Health Information tab, click on Add Foot Assessment and enter the relevant notes accordingly. After entering the notes, click OK to save the record. Please note, the queue system is only to indicate the completion of triage by the SOPD nurse. The foot care nurse is not required to update the queue. Once the triage has been completed by the SOPD nurse, they may return to the appointment reminder page to check in the next patient. Thank you for watching. Vinaka.